Did you know there's been more than 8,000 robotic procedures here at Trident Medical Center since the program began just 11 years ago? Thank you for joining us for this segment of Live Healthy. I'm your host, Lauren Collar, and here to tell us all about that is Dr. Litton. Thank you for being here today.
Thank you.
What constitutes a minimally invasive procedure?
Well, any minimally invasive procedure is a procedure that's done through a very small incisions, through limited access, but that also involves use of instruments that allow us to see inside the abdominal cavity.
What about the other specialties? What specialties at Trident Medical Center take advantage of this robotic procedure?
Well, the first procedures were done by urologists doing basically prostatectomies for prostate cancer, and that's where it started off. Gynecology came along very quickly and started doing hysterectomies robotically, and then the general surgeons were kind of the last to the table. But we do a lot of operations robotically now that we used to do as open procedures.
What are some of the specific ones you do?
We do colorectal surgery, removing any part of the large intestine. Basically, any sort of intra-abdominal operation you can do robotically with certain limitations. We do anti-reflux surgery, surgery on the diaphragm or the esophagus, anything on the gastrointestinal tract that's inside the abdomen, hernia repairs, gallbladder surgery.
How do you determine if a patient is a good candidate for a minimally invasive robotic procedure?
Well, just about everyone is. The only contraindications would be somebody that was at the extreme of body size, either very, very large or very small, or if they had had numerous previous abdominal operations, or if they'd had something like a mesh hernia repair, which would basically be a barrier to entry into the abdomen.
And then as far as patients, what are the overall benefits for them?
Decreased pain, increased return to normal activity, quick recovery, and I think prevention of complications. You see things so well, there are certainly some complications with any sort of surgery, but I think the risk is much decreased if you're able to see and manipulate tissue more precisely.
All right, thank you for being here today. Thank you for being here for this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.